Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation. And today we are going to talk about an article published in the British Journal of Urology International. It was published recently. The name of the article is Empiric Antibiotics for an Elevated Prostate-Specific Antigen Level, a randomized prospective controlled multi-institutional trial. This is a very important point because there is a routine of doing antibiotics prior to a biopsy when the PSA is elevated, believing that the rise is due to some infection. And actually there were studies in the past showing that this is actually a dangerous practice. And this study actually took a large number of patients from 5 institutions, which, by the way, one of them is the Department of Urology from Tel Aviv University in Tel Aviv, Israel, which I'm very proud of. And we see here Montreal, we see University of Chicago, Northwestern, and we see here that we also have the North Alabama Urology, Huntsville, and Penn State Hershey Medical School in Pennsylvania. So let's go now to the study itself. The objective of the study, it was to determine the impact of empiric antibiotics on men with an elevated PSA. The subject, patients and methods. Men of any age with PSA level of more than 2.5 and normal DRE were undergoing their first prostate biopsy, recruited from 5 medical centers, as I mentioned. Patients with previous biopsy, prostate cancer, urinary tract infection, or prostatitis within prior year were excluded. A patient that used 5-alpha reductase, like Proscar, they were excluded. And patients who were allergic to fluoroquinolones were also excluded. And we have to warn some viewers that the Cipro, you have to be very careful about taking that drug because some of the side effects are affecting some of the tendons. There are some side effects, and also there is a problem that maybe there is a resistance to some bacteria in the rectum resistant to these antibiotics. As a matter of fact, there are even people that are so careful about this that they do enemas or they do also culturing the flora of the rectum. Some men were randomized to 2 weeks of ciprofloxacin, which is Cipro. A PSA measure was obtained 21 to 45 days after randomization, before the prostate biopsy. The primary endpoint was a change in PSA level between baseline and immediately before the biopsy itself. The results. Complete data was available for 77 men with a mean age of 60.6. In the control group, men received antibiotics. The mean baseline and pre-biopsy PSA level were 6.5 and 6.9, respectively. In men receiving Cipro, the mean baseline PSA level was 7.6, and after 2 weeks of Cipro, the PSA was actually a bit higher, 8.5. Compared with control not receiving antibiotic, use of Cipro was not associated with a statistically significant change in PSA level. Prostate cancer was detected in 36 patients and 23 men in the control group. Conclusion. Empiric use of antibiotic for asymptomatic men with an elevated PSA level does not appear to be of clinical significance. So the question is, if somebody has an elevated PSA, should you avoid giving the antibiotics? Well, according to this study, there is no point, but I would say in order to ensure that the biopsy is not done unnecessarily, I think the following steps need to be taken. 1, repeat the PSA and make sure it's not a fluctuation. Number 2, make sure that you didn't have any activity that stimulates the prostate to make more PSA, like sexual activity. And recently, one of my friends had a biopsy because elevated PSA, only to discover that his PSA was elevated due to an aggressive bike ride for many miles, and that elevated the PSA. I still believe in doing imaging prior to the biopsy. The imaging should be even only the transrectal ultrasound, but if possible complemented by other imaging if available, like spectroscopic or multiparametric MRI. The point is that try to avoid doing biopsies if all possible, but if you avoid doing the biopsy, take the steps to monitor and make sure that you are not missing a prostate cancer. Thank you for listening. If you have any question, don't hesitate to call me at the following number, 1-619-906-4700, or write to info at pcref.org. I'm wishing you a happy and healthy new year. Stay away from biopsies if possible, but make sure that you are not missing it by taking extra precautionary steps. Thank you. Stay well and stay informed. Goodbye.